Well, hello. You're probably wondering what this is. This is actually a test that we do in occupational therapy, and it's called the TVSP4, which stands for the Test of Visual Perceptual Skills, 4th edition. And this test looks at 7 areas of visual perception. And this is an area that always confuses people because they're like, what's vision and what's perception and how does that work together? So I pulled out one example. I'm going to just look at one area of visual perception, which is visual closure. And I opened up a page of this test on how we test for visual closure. And as you can see, this box has it has a picture of the box in the center, but then it has these kind of partially completed boxes, and you have to pick out which one would be the box in the center. So visual closure is actually the ability to close in that space so you can see that object with only part of it being there. And visual perception has a lot to do with the way our eyes process information. And visual closure deficits can result in language deficits. They can also result in reading deficits. If we're not able to fill that space in, we're going to have trouble decoding. So those types of higher level skills have many surface level areas that integrate in so that somebody can visually process. And people always ask me, how quickly can we solve this problem? Well, it depends on whether you have one visual problem or whether you have 7 visual problems or whether you have other motor components that are going on. So that is a difficult question because it's hard to know how complex the situation is. Now, when we are working with a kiddo that has real severe visual processing issues, we will oftentimes work in conjunction with a developmental optometrist because we know that they're going to probably need more detailed vision therapy than we can provide. Remember, developmental optometrist or someone doing vision therapy is working exclusively on vision, but your OT is working on about 8 different categories. It could be sensory, it could be motor. So we vision's a part of it. It's a big part of it, but it's not everything that we do. So oftentimes we will refer that out. So that process of healing or restoration, we can't really tell till we know the complexity of it. But I will tell you, we do see these kids improve significantly with intervention.